Hi everybody, this is Dr. Palmer broadcasting from headquarters here at Pure J Pediatrics in Portland, Oregon. I'll reintroduce myself. I'm a general pediatrician. We have a private practice here where we see kids from newborn all the way to age 21. Hello there. And I thought that, so normally at 12:30 on Thursdays, we kind of talk about things that we've seen in the office and give parents tips on things that are salient to parenting and things that have to do with kids and babies. So I have been seeing a lot of strep throat this week. And some of you might know about it, but I just figured I'd come on and talk a little bit about it because I get all sorts of questions. So strep throat is a bacterial infection of your throat. It is highly contagious. So kids usually pick it up at school. Some of the symptoms associated with strep can include fever, sore throat, abdominal pain, nausea, or vomiting. Typically, if your child has symptoms of a cold, like a runny nose, congestion, or cough, and is complaining of a sore throat, it probably isn't strep throat because those are symptoms that are associated more with a viral illness, the runny nose, cough, and congestion. So if they have a cold and a sore throat, probably not strep throat. However, I do have parents concerned because it is circulating in the classrooms. And so if you're in doubt as to whether or not it's strep throat, it's always good to get a professional opinion. How do we diagnose this? So there are things that I look for on physical exam that are more compelling of strep throat, which are things that I'm looking when I examine your child. We also kind of take a history to see if there's a possibility for it being strep throat. But the diagnosis is made with a throat swab, which we can do here in the office. Your pediatrician's office, I'm sure, can do it as well. And that usually is diagnostic of strep throat. The good news is, compared to viral sore throats, we actually have a treatment for strep throat. And so if your child is diagnosed with strep throat, we can write you a prescription and treat it. And it generally responds really well to oral antibiotics. Here's the thing, if your child's diagnosed with strep throat and is on antibiotics, they cannot go to school the next day. You need to be on antibiotics for a full 24 hours before you can go back to school. And yes, you can infect everybody in your family. The weird thing though is that the strep that causes strep throat can be normal for some people. So we are coated with bacteria on the outside and on the inside of our bodies. And for some people, Group A strep is actually a normal, is considered normal flora. So I'll have parents who will bring their kids in who have absolutely no symptoms and are worried that the child has strep throat. And I generally will not swab that child. If they don't have any sore throat, if they don't have any other signs or symptoms of strep throat, I will not swab them because they could be normally colonized. So they can have it in their mouth and their throat and not be sick from it. And their brother or sister in the same family may have a high fever, a sore throat, tummy ache, and actually has strep throat. I know, it's a little weird, but that's why you don't want to just swab willy-nilly. You want to make sure that somebody has symptoms and then you swab them because then the test is a lot more definitive for it being strep throat. That may be a little bit confusing, but don't worry, we have lots of practice walking through strep throat with families, diagnosing and treating it. The other weird thing about strep throat is not everybody in the family gets it. You have to have certain receptors for Group A strep to get sick from it, which is why one child might be colonized with it and never get sick from it, and another in the family who has receptors could pick it up at school, come home and be really sick with it, and then we have to treat it. So kind of a weird bacteria. We're super familiar with it and really happy to walk you through it, diagnose it, and treat it. If you are in the Portland area and looking for a general pediatrician whose office picks up your phone call and schedules you, we have availability daily. Give us a call at Pure Joy Pediatrics, 503-420-8667. Take care.